the dumai. According to the treatise on hollow bones, the Suwen Gu Kong Lun, the du vessel starts in the lower abdomen, then goes downward. In women, it passes through the vaginal orifice. Its collateral branches off from the genitalia, joining the perineum and surrounding the outside of the anus. Another branch surrounds the buttock and continues to the Shaoyin kidney channel and joins the collaterals of the Taiyang bladder channel. The Shaoyin channel of the kidney ascends from the posterior aspect of the inner thigh, goes through the spine and connects with the kidney. The dumai also starts with the foot Taiyang bladder channel at the outer edge, at the inner canthus of the eye. So it starts along with the bladder channel, inner canthus of the eye. They ascend to the forehead and join the top of the head and go into the brain. From the brain, a branch descends through the neck and shoulder and along the medial side of the scapula, parallel to the spinal column, reaches the lumbar, where it connects to the paravertebral muscle and connects to the kidney. In men, the du vessel descends to the perineum and along the penis, corresponds to the female vagina. A branch ascends from the lower abdomen, penetrates through the center of the navel, passes the heart and throat, surrounds the lips, and reaches a location between the two eyes. In the 28th difficulty of the Nanjing, it says, the du vessel starts from du 1, enters the spinal cord, ascends to du 16, where it connects into the brain. According to the Ling Shu, when the sea of marrow is insufficient, there will be a feeling of dizziness, tinnitus, soreness in the legs, blurred vision, laziness, and sleepiness. In the Bone Hollow treatise it says, when there is a pathological change in the dumai, it will cause stiffness in the spine and arched back. In Plain Questions, Suwan Fenglun, the treatise of wind, it says invasion of wind goes up along to du 16 to reach the brain, and wind disease will occur. Du 1. This is for diseases of the genitalia. Below the tip of the coccyx, midway between the coccygeal tip and the anus. This is good for hemorrhoids, prolapse of the rectum, diseases of the genitalia, local diseases, mental diseases, in particular manic depressive psychosis or mania, why you're causing chi to descend, and diseases along the channel. Needle obliquely, 0.5 to 1 cun upward and parallel to the sacrum. Avoid infection, do not pierce the rectum, and don't use moxibustion. I have never used this one clinically. I don't want to lose my license. Other people do. Good for them. Du 2 to Du 5, this is in the lumbosacral region. Du 2, Yao Shu, on the posterior midline of the sacrum, just at the sacral hiatus. Menstrual stuff, lower jiao stuff. Needle obliquely upward 0.5 to 1 cun. Du 3, Yao Yang Guan, on the posterior midline of the lower back, in the depression below the spinous process of L4, Du 3 L4. Du 2 at the hiatus, Du 3 L4. Lower jiao stuff, genital stuff, and muscular atrophy and weakness in the lower limbs. Du 4, Mingmen, on the posterior midline of the lower back in the depression below the spinous process of L2. Do 4 L2. Reproductive diseases, lower jiao, all things, including the kidney's control of urine and stools, menstrual diseases, lumbosacral diseases, also absence of sweating, all things related to kidney yang and the Mingmen. Needle perpendicularly 0.5 to 1 cun. Do 5. 悬书 on the posterior midline of the lower back at L1. Do 5 L1. Stiffness and pain in the lumbar, undigested food in the stool. So undigested food in the stool is a characteristic of Do 5. Now why? This is kind of like 腹子里从完 in that the 腹子, or the kidney yang's ability to warm the spleen. And undigested food in the stool would be the spleen having yang deficiency. It would be a yang deficiency sign as opposed to an excess cold. I probably wouldn't use Do 5 for an excess cold. But for deficiency, absolutely. And really, Do 4 with moxa, you're going to get this point anyway. Do 6, จี中 on the posterior midline in the depression below the spinous process of T11. Stomachache, diarrhea, jaundice, stiffness and pain in the lumbar back, 0.5 to 1 cun. Do 7, 中枢 in the posterior midline in the depression below T10. Do 7, T10. Stomachache, lumbar stuff, 0.5 to 1 cun. Do 8, 筋缩 on the posterior midline at T9. Stiffness in the spine, stiffness in the tendons. Needle obliquely 0.5 to 1 cun. Do 9, 止阳 in the posterior midline at T7. Jaundice, stiffness, pain in the chest and back, 0.5 to 1 cun. Do 10, 灵台 on the posterior midline in the depression below the spinous process of T6. Do 10, T6. Cough, asthma, as well as do my back pain, 0.5 to 1 cun. Do 11, 神道 T5. So this is right by heart shu. So you can get an idea based on its spinal number that it's going to be good for palpitations, cardiac pain, poor memory, as well as back pain. 0.5 to 1 cun. Do 12, 宣注 on the posterior midline in the depression below the spinous process of T3. It's upper spine, so cough, asthma, lumbar spine pain, and furuncles, which would be brought or kept on by wind. Oblique needling, 0.5 to 1 cun. Do 13, 逃道 on the posterior midline in the depression below the spinous process of T1. Stiffness of the spine. Needle obliquely, 0.5 to 1 cun. Do 14, 大椎 in the posterior midline in the depression below C7. Do 14 below C7. Great for wind, great for fever because it's stopping the du's ability to raise yang qi. So in this way, it's able to drop fever. Chest and lung diseases, all things wind. Obliquely, 0.5 to 1 cun. Do 15, 亚门 on the nape, 0.5 cun directly above the midpoint of the posterior hairline, below the first cervical vertebra, below C1. Mouth and tongue diseases, loss of speech. This means mute, deaf, let's say a deaf mute person, gait. So this is good for aphasia, lack of speaking. Head and nape diseases as well. The patient sits with the head relaxed and slightly bowed, needle slowly and perpendicularly 0.5 to 1 cun toward the lower jaw. Do 16, Feng Fu. On the nape, depression between the trapezius muscle and 1 cun directly above the midpoint of the posterior hairline, directly below the external occipital protuberance. If somebody really has wind and it's caught here, and you just do even like a half cun needle, you can get them sweating. It's crazy when it's actually stuck at this point. Most of the time, if someone generally has wind and you do this point, it does nothing or nothing significant. But when it's specifically caught right there, it's amazing. Same is true for most of these points, but I've seen people just dump sweat as a result of this point. Externally contracted diseases, good for wind. Do 17. Nao Hu. On the head, 2.5 cun directly above the midpoint of the posterior hairline, 1.5 cun above Do 16. 1.5 above Do 16 is Do 17. Epilepsy, dizziness, head stuff, transverse 0.5 to 0.8 cun. We're on the head, you can't do perpendicular if you don't want to cause problems. And really the bone won't let you. You're going to have some pretty thick needles to get in there. Do 18, Qiang Jian. On the head, 4 cun directly above the midpoint of the posterior hairline and 1.5 cun above Do 17. So from Do 16, we went 1.5 up, 17. 1.5 up, 18. Do 19, Hou Ding. On the head, 5.5 cun above the midpoint of the posterior hairline and 3 cun above Do 17. Needle transversely, 0.5 to 0.8 cun, like the rest of these. On the head, Do 20, Bai Hui, 5 cun directly above the midpoint of the anterior hairline, or the midpoint of the line connecting the apexes of both ears. Headache, distending sensation, prolapse, because you're causing qi to rise. Mental diseases, you can also think of this like opening the teapot. It is a great way to vent off heat. Needle transversely, 0.5 to 0.8 cun. Do 21, Qian Ding. On the head, 3.5 cun directly above the midpoint of the anterior hairline and 1.5 cun anterior to Do 20. Dizziness, nasosinusitis, transverse insertion, 0.3 to 0.5 cun. So after Do 20, we go from 0.5 to 0.8 to 0.3 to 0.5, starting at Do 21. Do 22, Xin Hui. On the head, 2 cun directly above the midpoint of the anterior hairline and 3 cun anterior to Do 20. Which means we've added another 1.5 cun from Do 21. Transverse, 0.3 to 0.5. Don't needle this point in children because their fontanelle isn't closed and you'll give them a headache. So if I were writing a test, I would probably put that one in there. Do 22, don't kill them kids. Thank you for your consideration. Do 23, Shang Xing. On the head, 1 cun directly above the midpoint of the anterior hairline. Headache, eye pain, nosebleed, nasosinusitis, bipolar stuffs. Needle transversely. Now we're back up to 0.5 to 0.8 cun. Do 24. On the head, 0.5 cun directly above the midpoint of the anterior hairline. Head and mental disorders, spirit stuff. Needle transversely, 0.3 to 0.5 cun. Face points. Do 25, Su Liao. On the face, at the center tip of the nose. Boop, right in the center of the nose. Nasal obstruction, nosebleed, rosacea. mostly I've seen this for people with whiskey nose. People drink too much and then their nose starts to get red there. Then bleeding that will help vent some of that heat. Needle obliquely upward, 0.3 to 0.5 cun. Prick to bleed. Moxa is forbidden here because you'll burn their nose and make them look like Rudolph. So do 25 is the Rudolph point. The red-nosed reindeer. Do 26. Shui go. This is water ditch. And it's referring to the philtrum, this little snot canal. So it's on the face at the junction of the upper third and middle third of the philtrum. You knock somebody out, you can help wake them up with this point. This is also used as a striking point to knock people out, punch them in the teeth. Mental diseases, clenched jaw, disease along the channel. Edema, I think that's, it's listed as edema. I kind of think it's bullshit though, because the name of the point is water ditch, so people might use it for edema. But, yeah, I think that's stretching it. Do 27. 对端. On the midline of the face at the junction of the margin of the upper lip and philtrum. So you get people to make a weird smile. And, yeah, it's supposed to be good for bipolar disorder. Twitching of the corner of the mouth. Needle obliquely 0.2 to 0.3 cun. Do 28. Yin jiao. Inside the upper lip at the junction of the labial frenum and the upper gum. Also bipolar disorder, nasosinusitis. 0.2 to 0.3 cun. Now we go on to the Ren Meridian. According to the Treatise on Bone Disease, the Ren Meridian starts at Ren 1 on the perineum. It descends to the pubic hair upward to Ren 4, continuing up to the anterior midline of the throat, where it runs to the chin and along the face to enter the eyes. Ren Meridian goes to the eyes. The Ling Shu says both in the penetrating vessel and in the Ren Meridian, you find the origin in the uterus and that they ascend along the spine. They are the sea of the channels. The superficial, penetrating, and Ren Meridian ascend along the abdomen respectively and meet the throat, then go around the mouth and lips. In the Nanjing, it says, the Ren vessel originates under Ren 3, ascends to pass through the pubic hair, then ascends to the abdomen to Ren 4, and then along the anterior midline of the throat. When there are problems with the Ren, a man will contract 7 kinds of hernia. That's a lot of hernias. And a woman will contract morbid leukorrhea and abdominal masses. In this case, that would mean something like fibroids. Pathological changes in women can cause infertility, as well as dysuria, hemorrhoids, enuresis, and a dry throat. Ren 1, Hui Yin, on the perineum at the midpoint between the root of the scrotum and anus in men, and between the posterior labial commissure and anus in women. Good for genital diseases, mental disorders, basically kind of like do 1 as well. It's pretty much all the same indications. You'd think that the channels are sort of mirrored, but think of this like, what's the difference between 11:59 and 1 a.m.? It's not much, right? I mean, technically there's a change. First day of spring might still be pretty cold, right? So that's why these indications are the same. This is part of the cycle. Ren 2, Chu Gu, on the anterior midline of the lower abdomen, at the midpoint of the upper border of the pubic symphysis, lower jowl stuff, and hernia. Perpendicular insertion 0.5 to 1 sun. Ren 3, 中极, the front mu point of the bladder. Ren 3, front mu of the bladder. 4 cun below the umbilicus. Ren 3, 4 cun down, front mu of the bladder. So yeah, it's good for urination, abdominal diseases, liver and kidney stuff, gynecological diseases. Perpendicular 0.5 to 1 cun. Ren 4, 关元, the front mu of the small intestine. Ren 4, 3 cun down, front mu of the small intestine. Liver and kidney stuff, gynecological stuff, intestine, stomach stuff. And for deficiency syndromes or collapse of wind stroke, consumptive diseases, emaciation. That's because we're getting to the dantian area. Ren 5, 石门, the front mu point of the sanjiao. 2 cun below the umbilicus, Ren 5, is the front mu point of the sanjiao. So because of its location, lower abdominal diseases, liver and kidney and hernia, edema, because we're in the lower jiao. Gynecological, same thing. But this is the ability, similar to the kidney yang, to get the dantian really warming the stomach. And this is why it's good for undigested food in the stool, incessant diarrhea, etc. Needle perpendicularly 0.5 to 1 cun. Ren 6, qi hai, on the anterior midline of the lower abdomen, 1.5 cun below the center of the umbilicus. This is 0.5 cun off of Ren 5. Does it do kind of the same thing because it's 0.5 cun off? Sure it does. It's all the same stuff. Yeah. Also used for wasting disease. Functionally no different. Ren 7, yin jiao, on the anterior midline of the lower abdomen, 1 cun below the center of the umbilicus. Gynecological stuff, lower jiao stuff, perpendicular 0.5 to 1 cun. Ren 8, shen que, it's right in the belly button. Don't needle it. Use moxa and other, pack the belly button with salt or ginger. Abdominal pain, collapse, wind stroke, prolapse, incessant diarrhea. Ren 9, shui feng, water divide. So this one's really important, especially when dampness or edema is affecting fertility. It's really good. It's kind of like guizhi fulingwan in that sense. Abdominal pain, borborygmus, diarrhea, retention of urine. Ren 10, Shaowan, on the anterior midline 2 cun above the center of the umbilicus. So Ren 9 was 1 cun up from the belly button. Ren 10 is 2 cun up. It's good for stomach ache, abdominal pain, borborygmus, undigested food in the stool. 0.5 to 1 cun perpendicular. Ren 11, jianli, 3 cun up from the umbilicus. Stomach ache, vomiting, poor appetite, edema. Perpendicular insertion 0.5 to 1 cun. Ren 12, zongwan, influential point of the fu organs, front mu point of the stomach. Very high frequency, wonderful point. Some of these I gloss over. This one is really worth learning in depth. Good for all things spleen and stomach. Infantile malnutrition, really all things in the gut. It's right in the middle. Mental disorders due to phlegm or otherwise, gut stuff. There are some random indications because the spleen is at the center of everything, and this is treating the spleen stomach by being the front mu point of the stomach. It's important not to get caught up on all the manifestations because everything will relate to it. It just is good for that as a result. Everything else will benefit. Perpendicular insertion 0.5 to 1 cun. Ren 13, 相完, on the anterior midline 5 cun above the umbilicus. So this is 1 cun above Ren 12, which was 4 cun up. So Ren 13, 5 cun up. Good for stomach stuff and also vomiting, regurgitation. Acid regurgitation from the stomach helps to settle things down. Perpendicular insertion 0.5 to 1 cun. Ren 14, 巨阙, the front mu point of the heart. 6 cun above the umbilicus is Ren 14, the front mu point of the heart. Good for heart stuff, stomach spleen stuff, and as we're getting closer to the chest stuff. 0.5 to 1 cun. Ren 15, 九尾, the lower connecting point of the Ren Meridian. 1 cun below the xiphoid process. Chest and lung stuff. Heart and mental diseases, spleen and stomach. It's also used for epilepsy with points like Du 14. Needle obliquely downward 0.5 to 1 cun. Onto the chest 16 through 21. Ren 16, 中听, on the xiphoid level with the 5th intercostal space. Fullness of the chest and hypochondriac region. Regurgitation of food from the stomach. Ren 17, 淡中, the front mu point of the pericardium, an influential point of the qi, especially the zong qi. On the anterior midline of the chest, level with the 4th intercostal space, in line with the nipples. Used for insufficient lactation, heart and chest diseases, disease of the breast. Transverse 0.3 to 0.5. Ren 18, 玉堂, on the anterior midline of the chest, level with the 3rd intercostal space. Chest stuff 0.3 to 0.5 cun. Ren 19, 子宫, anterior midline of the chest, 2nd intercostal space, chest stuff 0.3 to 0.5 cun. Ren 20, 华盖, on the anterior midline of the chest, level with the 1st intercostal space, chest stuff 0.3 to 0.5 cun. Ren 21, 玄机, on the anterior midline of the chest, 1 cun below Ren 22, chest stuff. Breathing stuff 0.3 to 0.5 cun. Points of the face, Ren 22 and 23. Well, neck and face, yeah. Ren 22, 天突, and the center of the suprasternal fossa. Neck stuff, chest and lung stuff. Perpendicular insertion first, 0.2 to 0.3, then insert the needle downward along the posterior aspect of the sternum and the anterior aspect of the trachea, 0.5 to 1 cun. Also good for plum pit qi. Ren 23, 连泉, above the laryngeal prominence in the depression above the upper border of the hyoid bone. Tongue and throat stuffs. Also a local point for thyroid. Inability to speak. Protracted tongue. Yeah, all things tongue stuff. Perpendicular insertion 0.5 to 0.8 cun. Ren 24, 承浆, on the face, in the depression at the midpoint of the mentolabial sulcus. Swollen face. Swollen eyes. Manic depressive psychosis.